Hi, my name is Ryan Lockard, and I am a student physical therapist from Regis University. And I did a study that analyzed the muscular fatigue effects on muscle force and EMG amplitude. So, a surface electromyography is a technique that detects muscle electrical activity via electrodes placed on the skin. As you can see on the poster, a dynamometer was used in this study, and a dynamometer measures isometric strength of wrist and hand muscles. The purpose of this study was to explore how isometric contraction fatigue affects forearm flexors and extensors force production and EMG amplitude in hand grip. Our hypothesis for the study was that there would be an increase in EMG amplitude as the subject experienced fatigue. There were 8 subjects in this study with a mean age of 24 and a half years of age. The subjects were volunteers from the Regis School of Physical Therapy class of 2021. There were 5 males and 3 females included in the study. In order to be included in the study, you had to have no wrist pain or an injury, understand English, and the ability to perform maximal effort hand grip. Additionally, you could not be in the study if you had a latex allergy or an arm injury that limited range of motion in this wrist. Electrodes were placed on wrist extensors and flexors on the subject's dominant hand. While seated, the subject gripped the dynamometer with about 90 degrees elbow flexion, and the subject then gripped the dynamometer as hard as possible to get a maximum voluntary contraction as a baseline test for the study. The subject was told to grip the device with 25% of their maximum voluntary contraction force and maintain this force level for as long as possible. Peak force EMG values for grip force were recorded every 15 seconds until the subject experienced fatigue. As you can see on the poster, there are 3 graphs. Figure 1 compares EMG activation of wrist flexors versus time. Figure 2 shows EMG activation of wrist extensors versus time. And Figure 3 on the right shows force in relation to time. The results showed that both wrist flexor and extensor activation increased initially, but then decreased back down to about the same as our starting values. It's worthwhile to note that extensor activity was higher than flexor values. As you can see on the graphs, we had large standard deviations for our data, and this was partially due to the variability in our data. And as expected, the force EMG values were consistent over time. Our data showed that increased fatigue was correlated with increased EMG amplitude, which further supported the hypothesis. That increase in amplitude is also partially due to the increase in motor unit recruitment that is seen during muscular fatigue. Drops in data points shown on the right side of the graphs were a result of participants dropping out. So in this study, only 2 of the 8 subjects made it past 300 seconds in the study, so that data on the right side is only representative of 2 subjects. Additionally, variability of muscle fiber types between genders could have also been a factor in why our data had large standard deviations. This is of clinical importance because understanding muscle fatigue is pivotal for understanding muscle function as a whole. Knowledge of muscular fatigue can also aid a physical therapist with injury prevention measures and strategies. And lastly, understanding muscular fatigue can also be useful in prescribing exercise for patients with neuromuscular disorders and also monitoring their progress.